So tonight we're hosting Jake, is it Gillanders? Gillanders. He's a speaker with a unique perspective. He's a 25-year firefighter, currently serving as a captain, medical officer, and urban search and rescue task force leader. Jake is also executive director of Empact International, which is a nonprofit dedicated to disaster preparedness and response. This perspective lends valuable insight to the government nonprofit relationship, as well as to disaster preparedness and response. Jake has deployed way more than 20 times to locales impacted by disaster around the world, from Oso, Washington. Remember that?
Also, big lands.
Yeah, that little.
Yeah.
To Kathmandu and all points in between. He's an experienced nonprofit manager with past roles in communications, operations, and executive leadership, with 20 years of real-world fire rescue and EMS experience, currently serving as captain with the fire department in Western Washington. He's experienced international disaster responder with past roles in rescue, logistics, medical, and command. So he's a pretty cool dude. He is currently serving as task force leader for 2 domestic and international search and rescue teams, has extensive teaching, training, and lecturing experience in a broad range of topics from the nonprofit, rescue, fire service, and EMS industries. So let's welcome our speaker, Jake. Thank you.
That intro makes me sound way more qualified than I actually am. So I appreciate it.
Very nice.
Okay, thank you. I appreciate that. All right. Hey, thank you very much, everybody. I appreciate the opportunity to come speak tonight. I'm going to try and make sure I'm staying in the camera here. So if I glance over here, that's why. Really appreciate the opportunity to come out and speak tonight. I'm going to give my 2 disclaimers that I give every time I talk. First, I talk way too fast. Number 2, I never say in 5 words what I can say in 10. So you're in for a ride. It's gonna be a lot of words and they're gonna come at you really fast. If at any point I'm talking too fast or saying too much or moving too quickly, just let me know, throw something at me, hit me with a bottle of water and I'll slow down. But those are my bad habits and I'm already coffeed up. So it's probably just gonna get worse from here. So we'll jump into it. So that was a great intro. It kind of makes the next slide a little superfluous. Screen. So this is me. I'm here to talk tonight about Empact International, which is a nonprofit organization that I helped found in 2010. I currently serve as the executive director of that organization. In addition to that, as was mentioned, I've got 25 years now of EMS and fire experience. I started in 1998, and I've been with the Paulsville Fire Department since 2006. So I originally started in North Mason County, and then in 2006, I moved to Paulsville, where I've been ever since. I'm currently a captain with the Paulsville Fire Department, and my assignment right now is I'm the medical officer, which means I'm responsible for all of our medical operations. I work Monday through Friday. I drive a desk most days. I still get out in the field sometimes, but most of my work is writing memos and emails. But I oversee all of our paramedics and EMS training and EMTs and delivery of those services, along with our social work program, which I'd love to come back and talk about another day. It's a whole nother conversation, but Paulsville is actually on the cutting edge right now of bringing social work to the field through firefighters and partnered with social workers. So another topic for another night, but it's something I'm very passionate about. And then in addition to all of that, I'm also the program manager for Kitsap County Special Operations Team, which is essentially, it's our technical rescue and urban search and rescue task force. So all of the fire departments work together so that if there's ever a major incident, we can bring all of our resources to bear for large scale disasters and technical rescue events. And technical rescue is anything that's beyond the capabilities of your typical firefighter. So we do trench rescue and structural collapse and rope and confined space, those sorts of things. And so that's my other job, because I'm just not busy enough. I live in Kingston. I've got a wife who is very patient, who's been with me since 2005, and we've got a daughter. So as if I wasn't busy enough, I tend to stay busy with those guys too. So let's talk about Empact International. You may have heard of us under our old name, Empact Northwest. We've just gone through a rebranding here in the last 6 months from Empact Northwest to Empact International. And that's because of a recent shift in our focus that we're going to talk about, and a little bit of an identity shift as an organization, trying to capitalize on both lessons learned and sort of the best method of doing things from the private sector, public sector, and the nonprofit sector. We were founded, like I said, in 2010. We're based in Kingston. We don't actually have an office space. We all work out of our homes. So our office space is a PO box and a storage unit where we keep all of our equipment. And we all maintain home offices, all of our staff do. And then we do three key things. We do rescue training. We work on emergency systems development in developing nations, particularly in the Caribbean basin. And then we do disaster response. So we actually respond with teams anywhere in the world to large scale disasters. And we call those, we respond to what we consider systemic disasters, which would be any disaster that overwhelms local resources. So if it's something that's managed locally, for instance, we were asked if we were deployed to the building collapse in Florida. That would not be within our remit because that's something that can be managed by local resources. Counter to that, we did respond to Turkey because that was an event that overwhelmed the system that existed in place. And we are an international NGO. We have an emphasis on the continental US, particularly the Gulf Coast of the US, and then the Caribbean basin. Those are what we consider our primary areas of responsibility, although we deploy around the world for disasters. Our mission as an organization is pretty simple. We try to keep it short and sweet because most of us are firefighters, so we had to keep it pretty simple. And that is simply train responders, prepare communities, and respond to disasters. Everything we do points back to one of those three pillars of our organization. And everything we do is driven by our values. We are a values-driven organization first and foremost. When we redid our strategic plan, we started with values. When we went through our rebranding, we started with values because everything we do has to come back to those core values that make us who we are. And if it doesn't, then we strayed from our path and we have to come back to it. So these are all pretty boilerplate, right? Service, empathy, dedication. You're going to see these with every nonprofit. The two that I think make us different than everybody else, though, are those last two, audacity and flexibility. And what you'll see as we talk about what our organization does is we do the things that nobody else does, and we go to the places where nobody else goes. By design, that's who we are. When the UN and all of the FEMA resources end up in one large area of population, we're the next town over, because those are the people who have been just as affected by a disaster, but aren't necessarily getting those same resources. So we're audacious and we're flexible. For instance, you mentioned Kathmandu in the intro. We were one of the only crews, we were one of the first crews to get to a lot of the remote villages. While the other crews were trying to find ways to get trucks in and helicopters, we threw backpacks on our backs and we hiked it. And we were the first ones to get into those more remote areas and determine needs and then communicate those back out. And so when I say audacity and flexibility, that's what I mean. We go wherever the mission is and then we do whatever the mission is or whatever needs to be done. Statement of purpose, it's a lot of pretty words on the screen, but at the end of the day, that last sentence is the one that matters. We're here to save lives, whatever that looks like. And if we can save lives through response, that's fantastic. But if we can save even more lives at a lower cost through preparedness and systems development, then all the better. Everything we do, though, is tied to that core mission of saving lives. It all points to that. Brief history of who we are. As I mentioned, we started in 2010. We were at 70 disaster response deployments when I put this together. That was 6 months ago. So I think we're at 73 or 74 now. We're getting up there. We have a FEMA task force equivalency of 3-4. And so what that means is probably not a lot to this group necessarily, but what that really means is FEMA has established a criteria basis for USAR urban search and rescue task forces. And we fit right at the middle to end of that model. We're a light USAR task force. Our model is to get in early, quickly, and do the most work as effectively as quickly as possible. So we set things up for the bigger teams that come behind us. Local firefighters trained, this number has also changed. This was 268 as of a few months ago. We just graduated, I think, 16 firefighters since then here locally, and that's right in Kitsap County. So that would put us at 284 firefighters trained so far. And we estimate we've impacted well north of 2,800 lives right here in Kitsap County so far. And we estimate that by saying for every firefighter that we train, they use their skills that they've learned in one of our courses anywhere every 1 to 2 months. And so it's not a perfect measurement, but it's a measure of the impacts we're having here locally, because it is important to us as a Kitsap County organization that we're not just serving the international setting, but that we're also serving here at home and making our own families and communities safer as much as we're doing it for other folks. So an organization without problems to solve is just a hobby, right? So at the end of the day, if you're going to have a business, if you're going to have a nonprofit organization, you have to know what the problems are that you're trying to solve. And so for us, we identified 3 really core problems that we were well positioned to well situated to manage. And again, You're very fortunate to hear all this right now because we're just coming out of a rebuild. So we've had to really tear down our entire organization and figure out who we were and who we are and who we want to be moving forward. So we've really been able to have this fortunate experience in the last year or so to kind of crystallize our mission and really get a better handle on who we are and what we, which is where a lot of this comes from, is those, I don't want to say listening sessions because that's overused, but those opportunities to sit down as a team and really discuss what we're doing and where we're going. So the first one that we wanted to address was training. There is, outside of Empact International, there is currently no other provider of structural collapse in Washington State. It's us and King County fire agencies. And those King County fire agencies really only train internally. So they train their agencies, which meant the vast majority of folks that live in Washington State, their firefighters that serve them were not getting adequate structural collapse training when we started. In addition to that, there was very limited access to rope rescue training. And so what rope rescue training was available was either very expensive and difficult to get into, or it was mountain rescue based, which is not necessarily applicable for the scenarios that firefighters are facing, right? Pulling somebody off of a bridge, getting a window washer off the side of a building is a far different scenario than working in the mountains with a stranded hiker. So what we found was that there was no good training for those fire service professionals that were responding to our emergencies every day. And we identified that very early in our organization's history as something that we could address. And that's because all of us who make up this organization came from those backgrounds. We're all active firefighters. We're all active on rescue teams locally. All of our instructors today are assigned to technical rescue teams around the region. So training was our first one. The second was preparedness, specifically in the Caribbean region. A lot of developing Caribbean nations have very limited access to adequate emergency response capabilities, emergency training, or development. And what we found is a lot of times the Caribbean basin gets, I don't want to say it gets forgotten about, but it doesn't necessarily get the attention that other parts of the world get, particularly from Americans. I think a lot of Americans think of the Caribbean as turquoise blue water and white sandy beaches, and that's great. It's a beautiful place to visit. What we forget a lot of times, though, is that right outside of our resorts, a lot of these are really desperately poor developing nations. And so it's very easy to lose sight of that. We very fortunately, early in our career or early in our experience as an organization, we did a lot of work in Haiti, and that made it very clear to us the need in the Caribbean region. In addition to that, the Caribbean region, the Caribbean basin is seeing nothing but an increase in disasters. As we watch climate shift occur, regardless of the causes, we're seeing more storms, we're seeing storms of greater severity, and we're seeing more people being impacted. So when we couple the developing status of a lot of those nations with the high risk for disaster impact and low resource abilities internally, it was a recipe for success for an organization to have a significant impact in the region. Add to that it's a lot easier to get to the Caribbean than it is to other parts of the world, and it made sense for us as a fit as an organization. And then the third leg is response. So the national and international response frameworks, they're really built around large NGOs and large actors. They're designed to function for the United Nations. They're designed to function for large multinational teams. And if you live in a large population center, that's a good thing. When the United States deploys our federal urban search and rescue task forces to Port-au-Prince, you get immense resources, millions of dollars, hundreds of personnel, the latest equipment. It's a good model for the large population centers. But as soon as you step outside of those large population centers, the level of assistance provided by those large NGOs and large government entities drops off very quickly. So we saw this need on the fringes of those population centers, right? The analogy I make is it's Seattle versus Burien, right? So if there was a large scale disaster, all of those resources would go to the city of Seattle. Well, the city of Burien has well north of 80,000 people living in it, right? That's a dense population base that may get no international or national resources. And so I try to use that as a comparable analogy for people to understand. An even better one might be Kitsap County. Kitsap County is a county of almost 400,000 people now, at least during the day with folks coming in. We would see almost none of those national resources for at least the first week of an event. So that to me is sort of the analogy that I can use for where we work. We work in the Kitsap counties of the world, where you still have a large population, but perhaps not as large as the areas around it. Ma'am.
So in other words, let's say Kitsap County, there was a disaster.
Mhm.
For the first week, the resources are limited to the fire stations, and if such, they're already here.
Correct. To your locally available resources. So that means the fire departments. It also means Kitsap DEM. It also means regional resources, from Clallam County and Jefferson and Mason, we all have county compacts. And so I don't want to paint the picture that Kitsap would be in trouble. I think we would be fine because of those resources. But if we were in a place like Haiti or the Dominican Republic that didn't have that level of infrastructure around emergency management, it would be much more concerning. I don't have a lot of concerns about Kitsap County. Our DEM does a fantastic job. Our fire departments are very conscious of the risk of earthquake and major disaster. So we're very fortunate here, but no, we would not see those national resources that would go to Seattle. Those would all get bottlenecked very likely at Boeing Field. Man. Department of Emergency Management. Sorry, I speak in acronyms. I should have given that warning too. So again, feel free to throw something at me. I also have a terrible mouth, and it's enough for me just to try and tame that, so I lose sight of the other things. So please let me know if I start speaking in acronyms. I talk like a firefighter, so as soon as I get out of here, my language gets much worse. So within response, we had to narrow down what were the things we were going to respond to, right? It's not enough to say we're just going to respond. We can't respond to every disaster in the world. We can't be good at every disaster, every type of disaster. So we had to narrow down what it was we were going to do. And the first thing we landed on was Atlantic hurricanes. And that's because of the ease of response, our history working in the Caribbean basin and the Gulf Coast, and the increasing need. Climate shift is a reality. We are going to see more storms. We're going to see storms of greater severity. There's plenty of debate about what's causing climate shift, but I don't think there's any debate left as to whether or not it's actually occurring. And so we're seeing more of these, and we have to be ready to respond. As a matter of fact, between 2021 and 2030, they're predicting 97 total hurricanes, 43 of those being classified as major hurricanes, which would be 3 or larger on landfall. So that's a significant storm, and that's at landfall. So there's lots that become 4s out here and then dissipate before they get to land, but they're predicting 43 major hurricanes to make landfall in the next 10 years. Well, next 7 years now. Financial loss is predicted, ma'am.
And those are specific to the Caribbean area or those little dots up there?
So that would be Atlantic hurricanes. So anything off the Atlantic, the vast majority of those, will end up in the Caribbean region or the Gulf Coast.
The 43.
I believe the 43 is total Atlantic hurricanes, major hurricanes in the Atlantic, but the majority of those will land, and I don't know the exact number, would land in that Caribbean region, just because of the way hurricanes work, right? Somebody explained to me once the swirling water. It doesn't make sense to me, but smarter people than me have figured out why it is. And then they estimate $1.7 trillion of financial loss in that time frame, and over 8,200 deaths. I mean, that's a pretty significant number. 8,200 people killed just by hurricanes over a single decade is a pretty significant number. And then we figure they figure that 104 million people are at risk from hurricanes, and of those 60 million are right here in the United States. So again, we respond not just to the Caribbean basin, but also the Gulf Coast. We're very active in Louisiana and Florida every year when large scale storms come through there. Occasionally Mississippi, but Mississippi has such a narrow sliver of the Gulf that they tend to not get hit quite as bad as the other states around them. The next one that we wanted to focus on was global earthquakes. And the reason we wanted to focus on global earthquakes is because frankly, we're good at it. Urban search and rescue is really built around that earthquake model. So we do a lot of work in structural collapse. We do a lot of work in rope rescue. And those skill sets lend themselves well to that internet or to that earthquake environment. We just deployed to Turkey this year, for instance, and we've got lots of experience responding to earthquakes around the world. 19 major earthquakes in 21. There's about a 50% chance of a 84% chance that we're going to have a significant earthquake here in the Puget Sound region in the next 50 years. And the average financial impact per earthquake is $2.1 billion. So every earthquake that we experience here in the United States has an average cost of $2.1 billion. It blew my mind when I was researching this information, the financial impact of these events. And then here locally, 800,000 people live or work in susceptible buildings in the Puget Sound, which also blew my mind. That is a terrifying number. Hopefully, when we do have our earthquake, it happens at night, because a lot of those buildings are concentrated in the downtown core areas, Seattle, Everett, Tacoma. So hopefully, when we do have it, it'll be in the evening or at nighttime when people are not in their offices. And the newest one for us is international conflict. We had never gotten engaged in the international conflict space until the invasion of Ukraine. That was sort of our debut onto the scene when it comes to international conflict. But we found that because of our audacity and our flexibility, this is an environment we operate in very effectively. We work on a small team model. And again, with those concepts of audacity, flexibility, going where nobody else is willing to go, we found that we were able to be put to really good use in Ukraine in response to the conflict. We always maintain neutrality. We don't work directly with the military, except in areas of security. But we do a lot of work around delivering supplies where it's needed most. And we're going to talk a little bit more about our ongoing mission in Ukraine. But we've done a lot of logistics relief work, a lot of telecommunications work, and we also have a rescue team based in Ukraine right now. And then the last thing in the response space, and this is probably one of the most important things, is the idea of silos, right? And we've all, I'm sure within our respective industries, we're all familiar with the concept of siloing. This is very prevalent in disaster response. And it's really unfortunate that it is. But we find that these nonprofit groups, they get themselves locked into their silos. And it's very difficult for them to function outside of those silos. And it's very difficult for them to even see outside those silos. And by being flexible and by being small, we've found that we're very adept at navigating between those silos and creating connections between the silos. And this has become one of the key areas of our work, especially when we deploy internationally, because we have great relationships with government actors and we have great relationships with NGOs. And a lot of times we're the ones who are able to bridge that gap between them, or who are able to make connections from the sanitation silo to food and hygiene. People that you would think would be talking together every day, but they rarely do. And we found that by being small and flexible and being friends with everybody, that we're very good at helping make those connections. We don't believe in competition in the NGO space. Unfortunately, that's kind of unique to us. There is competition in the NGO space, but we do our best to try and eliminate that competition to make sure that the services get where they're needed. There's a space for competition, but it's not in the response phase. So how do we solve these problems, right? Problems are great to identify, but then you got to do the next step and come up with how you're going to solve those problems if you're going to be effective. In the training space, we get engaged in a couple areas. First of all, we do courses right here domestically, right here in Bremerton. We taught 5 courses this year. Next year, we're looking at 6 to 8. And we're going to be expanding into even more advanced rope rescue and structural collapse rescue training here locally, not just for Kitsap County firefighters, but as our reputation has grown, we're drawing people from all over Washington State. And our last class actually had members from British Columbia coming down for our training. So one of the really unique things about our organization is that not only do we train well, but we have the experience to back it up because we do deploy to these disasters internationally. We oftentimes are some of the most experienced rescue providers in the region because we've been able to deploy to those disasters and see those things. A lot of local rescue providers have never had that opportunity to see a large-scale disaster. And so we're able to bring a lot of that experience to bear to our courses and teach not just what's in the book, but what works well out in the real world and out in the field. And then in addition to providing training here, we provide training in developing nations at no cost to host regions. So just last week, I was in Belize teaching a rope rescue technician course to the Belize National Fire Service. And we provide that service at 0 cost. So we provide training here locally at a very affordable cost to the local fire agencies. We do sometimes no cost training here locally for volunteer fire agencies. But then we take that money that we raise doing that, and we use that to enable us to teach no cost courses in developing nations. And again, to those small volunteer agencies that wouldn't otherwise be able to afford that training. And it's a really important part of who we are as an organization, is providing training not just to those who can afford it, but also to those who need it, but may not have the fiscal resources to manage it. In the preparedness space, we prepare communities through emergency systems development, and really specifically within that emergency systems development phase or space, we work on incident management training. So that's how do you get the mayor talking to the fire chief, talking to the emergency operations manager, and all speaking the same language to get the problems solved, right? So we do a lot of work in that space. We do some work in strategic planning for developing nations' fire services. So we work with local fire chiefs, for instance, in Belize or Haiti, the Dominican Republic, and help them develop modernization plans to bring their fire service from where it is today to where they want it to be. We do dispatch implementation and training using a lot of modern technology that significantly reduces the infrastructure costs of implementing a new dispatch system. And then we do rescue training, like I said, internationally as well, and in those developing settings. And in the response phase or response space, we provide several different models of response. The first and most common is what we call a Pathfinder's model. As I mentioned, we're friends with everybody in the industry. So one of our jobs is to put people on the ground very quickly. And we're generally one of the earliest teams on the ground. So generally within 24 to 48 hours of a large scale disaster, we'll have a team of 2 to 4 on the ground getting what we call the ground truth, right? We can learn a lot from CNN. We can learn a lot from MSNBC, but it's not always very accurate, right? And we've found that the only way to get true ground truths is to put people on the ground and learn those lessons. So a lot of times we're with the first element on the ground, and then we're feeding information back not only to our own teams, but to our partners in the space so that they can make good plans and implement good response models for the specific disaster. We still have a rescue team. We deploy rescue technicians from here locally around the world in response to these disasters. We have physicians, we have nurses, we have specially trained disaster search canines, which are different than the dogs you might see working in the woods. So these dogs are very specifically trained to work on rubble piles and in collapsed buildings and find people very deeply entombed in concrete. My wife actually is one of our dog handlers. I don't always love her dog, but he's very impressive. They're very high energy dogs, which can make them a lot to manage, and they're very intelligent, which can make them very stubborn. I would be lying if I said I always loved that dog. I don't, but he's very impressive at what he does. And then we have technical search capabilities. So that's search cameras, acoustics, seismics, and really what we bring to the table that a lot of developing nations don't have is those specialty resources. So when we respond, oftentimes what that looks like, we may only have a team of 6 to 8 people, and we'll partner up with local fire agencies or local emergency response agencies and be what we call a force multiplier. So we can bring the physician, we can bring the rescue specialist, we can bring the specialized tools, and we can marry ourselves to a team of 10 or 15 local firefighters who may be adept at rescue, but may not have those special capabilities so that we can be that much more effective and successful working together. And then we do a lot of relief work. So once that initial acute phase of the first 96 hours, yes, ma'am. Oh, I'm sorry, I thought you had your hand raised.
Well, I was just going to reflect because you talked about structural disasters. And I was thinking of Turkey. And, you know, I grew up in the Middle East. Okay, so it's very familiar with Turkey and all these different places where they would have earthquakes all the time. And it seemed to be repetitive that these countries do not go back in and build structures that can withstand these earthquakes. Do they get any advice, or is just kind of bribery and all the other stuff that goes on? I mean, there was stuff in the news about Turkey of how they were going to go after whoever built all those buildings and stuff.
Yeah, Turkey is sort of a unique instance because Turkey has building codes. Turkey has very intelligent engineers. They know how to build buildings properly. The problem is there's no enforcement on the back end. So they have the codes, they have the engineers, they have the designers, but my understanding is that at the local level, there's very limited enforcement of those codes. And we run into the same thing in the Caribbean a lot. What we were told just recently, for instance, in Belize, is that the builders know that it's cheaper to pay the fines than it is to build properly. And they know that the local authorities aren't going to make them tear the building down once it's already been built. So they just build the building however they want to build it to save money, and then they just pay the fines at the end because it's cheaper for them to do it that way than to properly build in the first place.
Do they ever have to respond to any kind of criminal charges?
And I'm sure somebody has somewhere, but each country is going to be different. I don't know. I know in the United States, we hear stories of people being held criminally liable for negligence. A lot of the places we work, though, don't have well-developed justice systems necessarily. Belize, frankly, and I don't say this in a derogatory way, I love Belize, but Belize is so focused on managing gangs and drug crime that they just don't have the bandwidth to go after buildings. It's just not a high enough priority when they have so many other challenges they're trying to deal with already limited budgets and limited capabilities. It's really easy coming from the US to forget how fortunate we are to have a functional government, right? And so much of the rest of the world doesn't have a government anywhere near so functional as ours. And I speak that knowing full well what Congress is like right now, right? And even this is functional compared to a lot of the world.
In Florida, they just completely collapsed, a huge building.
And I don't Yeah, I don't know enough about that. One of our structure specialists has filled me in a little bit, and it sounds like what that instance was is there. I don't know that there was any one person to be held liable. My understanding from what he did on his postmortem review of it was that it was a series of errors, and no one error led to the collapse. It was lots of little tiny errors that just compounded one on top of the other. And so a lot of times with these large scale collapses, it's really hard to say it was this one thing, you know. Maybe the engineer cut a little corner, and then maybe the builder cut another little corner, and then they didn't do maintenance properly. And you know, if they had done the maintenance properly, then the corner that was cut by the contractor never would have been exposed. And so it's just hard to sort of tease out where responsibility lies. And that's why we see insurance companies doing what insurance companies do.
Yeah.
So what's that?
They move out.
They move out, right? Yeah, they move out. Okay, so current operations. So what are we doing right now? So right now in the response sector, we're still very active. And what that means at the moment is frankly just being ready. Hurricane season is here. So we've spent the last couple months getting ready for hurricane season, making sure our gear is ready, making sure our people are ready. A lot of our folks, so all of our folks work voluntary basis when we deploy. So they all take vacation time from their jobs. A lot of folks have already lined up their vacation time for August and September to make sure they're available to respond to these. But we still have a robust response capability that's domestic and that's international both. As I mentioned, our last major deployment was to Turkey in February of this year. So the question was, how do we manage logistics and relief? So our focus in the logistics and relief space is what we call last mile delivery. So we're not the people who get food from the United States to Turkey. We're the people who get it from the airport in Turkey to the tent encampments. And that takes a lot of different versions. We've man-packed food before, where we literally put on backpacks and haul canned food across a trail, all the way to sourcing local vehicles, renting trucks. We did a lot of last mile delivery in Ukraine. We did a lot of last mile delivery in Turkey. And one of the unique things about our organization is that our people understand that there's no job beneath us. So you may deploy as a physician, you may deploy as a rescue provider, but your job may end up being driving food overland. We've had physicians dig latrines, right? We've had firefighters driving trucks overland in the middle of the night through the middle of Turkey to deliver food. And that's a really important part of our culture, is that there's nobody above any work and there's no work beneath any of us. So we really focus, like I said, in that logistics environment on that last mile delivery and getting the food where it needs to be. If you watch large scale disasters, there's very often a bottleneck at the airport because there's great resources to get everything to the country that needs help, but that's usually where it falls apart. And so we've really tried to work our way into that last mile phase to make sure it gets where it needs to be. And then we combine that with our ground truth to make sure that it's actually getting where it truly needs to be. So for instance, somebody asked earlier, in Turkey, we were heavily involved in supporting some of the displaced Syrians who had crossed the border because of the earthquake and because of the lack of resources in Syria, but they weren't being assisted by the Turkish government because they weren't Turkish citizens. And so that's where we found our niche in that relief phase. Ma'am.
How many volunteers do you have, and are they all from the Kitsap County area?
Yeah, so we have 53 volunteers and staff on our roster right now. So of those, I believe 38 are volunteers, the remainder are staff. And they're all Washington, Oregon. I'd be lying if I gave you a percentage. It's a significant chunk right here in Kitsap County though. Yeah, but all Washington, Oregon. We don't have anybody from outside the area, outside this immediate area. And that's by design. That makes our travel easier because we have to get our whole team together at SeaTac. So if somebody's coming from Chicago, it makes it much, much more complicated. We've tried it in the past and it didn't work well for us.
I like the questions coming from the audience, but that might also interfere with your getting through the talk. So is this okay with you that
This
we
is
just
fine.
come, and will you have time enough to get to the end?
Sure.
Good enough.
One way or t'other. So we're still very active in response. We have that rescue component, the medical, which is made up of physicians, nurses, and paramedics. Technical search, which again is cameras and drones. We do have a drone, we've got a camera, we've got acoustics and seismic devices, which are really impressive. You can be literally under 30 feet of concrete and they can still hear you, which blows my mind every time. I am not one of those people. I don't understand how it works, but it's amazing to watch. We've got that canine search capability with those specially trained disaster dogs, and then the logistics and relief piece. We talked briefly about rescue training. So this is both here domestically in Bremerton. All these photos are taken right here in Bremerton. So we do rescue systems 1, rope technician, advanced structural collapse and rope rescue training. And then, as I mentioned earlier, this supports a lot of our other operations. And what's unique about us in the training space is we're one of the only training agencies that has real world experience to bring to our local firefighters here and apply not just what's in the book written by engineers, but what actually works in the field, and be able to leverage that experience. We're still very active in Ukraine. This is Libby, our search dog. She's in Kherson right now with her handler. So they're doing a lot of relief work, but they're also standing by, and they deploy very frequently to rocket attacks. So they'll shelter during the attack, and then they deploy out immediately with local fire authorities to do search work. And then they're also helping the nation of Ukraine expand its own internal search team right now, which is really, really exciting for us. Our primary mission in Ukraine, though right now, is Starlinks. And if you're not familiar, Starlinks are the Elon Musk satellite internet system. And so what we've done is we've got 6 of these Starlink receivers that we've deployed throughout the country to serve civilian populations. And the Ukrainians have built what they call invincible points. So every nation that's on the front, or every city rather, on the front line will have a local point that's a reinforced position, sandbags and that sort of thing, where the local population can shelter. It's not for military personnel, it's not for combat, it's so that civilians have a safe place to go. And we've positioned our Starlinks there so that during rocket attacks, or even not during rocket attacks, people can go there and they can get internet access. And we found that that's been really, really essential, not only for people to access family outside and let them know they're okay, but for physicians and medical appointments. What we found is a lot of these towns will have just a single general practitioner left in the town after everybody else has fled. So this allows them to reach out to specialists in Kyiv or Lviv, or even in Poland, and get those specialty consults for folks where you might have a general practice physician managing somebody with cancer locally, but who's conferring with an oncologist back in a major population center. And then the really surprising one, the one we didn't see coming at all, has been education. A lot of kids have not been able to evacuate from their areas, right, from where they live. But their teachers have fled, their schools have closed. And for months and months and months, they didn't have any access to education at all. And so a lot of these towns, the kids are going to the invincible point and using our Starlink connection to connect to teachers in Kyiv and Lviv to make sure that they're keeping up with their schooling. So these kids, even though they're living in areas under siege, are able to maintain their education so that the war slows them down rather than stopping them. Right. And that's been something that we never saw coming when we built this Starlink, but I think it's probably built a Starlink network, but it's probably our greatest contribution to the long-term health of the people of Ukraine. It's the one I'm most proud of, right? As the parent of a daughter, as the father of a daughter, I can't imagine her being stopped in her development and education for, who knows how long. So it's one thing I'm most proud of what we've done in Ukraine. And through those, we're doing 170 half-hour video calls every single day. So those are doctor's visits, those are classroom sessions, those are calls with family who may or may not know that those folks were still alive. A lot of times these are the first connections people have had with their families in 6 months to a year, right? Where maybe family has fled somewhere else in Europe, and these folks are finally able to make it to a town that has a Starlink connection and let their families know they're okay. So we're having a massive impact in people's lives. And again, this is probably one of our projects that I'm most proud of. It's one of our easiest lifts. It was a big lift to get it going, but now that it's there, all we have to do is pay the bill every month, and people are getting essential services. So really proud of the work we're doing there. And then obviously Libby and Dave are doing incredible work too. We have a project going in East Africa right now that's actually winding down. We were working with several EMS agencies throughout Kenya and Tanzania to develop a standardized first aid training curriculum and a standardized dispatch system. And what's really exciting, and the name escapes me right now, but there's a name, Boda Boda. So these guys on the motorcycles are called Boda Boda drivers. And a Boda Boda is a motorcycle taxi that you can hop on and zip around town. And what's really unique about these countries, they don't have an established EMS system. So working with one of our partners, we were trying to address how can we get early access to medical care and first aid to folks in the streets utilizing local resources. And what we landed on was these Boda Boda drivers. So these guys have all been trained in advanced first aid now, and they've been tapped into a dispatch system. And so when there's a medical emergency or a collision, they don't necessarily notify just the ambulance, they notify the ambulance and the Boda Bodas. And whoever's closest from the Boda Bodas will respond to the scene, and for a small fee, will not to the patient, but to us, will provide immediate first aid and medical care to those folks. So we've significantly improved rapid access to early medical care. And then they also serve as a triage function to either bring in an ambulance or cancel the ambulance, which has made the existing EMS system much more efficient and effective. So very exciting stuff that we're doing there too. Also, you'll hear me say this over and over. This is one of the ones I'm most proud of because I'm most proud of everything we do, right? And then we're very heavily involved right now in Belize. I've mentioned it already a couple of times, but we are deeply engaged in Belize right now in helping them develop their emergency systems. And this is probably most of our work at the moment, other than response, is what we're doing in Belize. We've completed a nationwide risk assessment. We're working on that incident command model and incident management training that we talked about. Fire service modernization, which includes centralized dispatching, which we're going to talk about in just a moment. The rescue training, we're working on developing their fire officers. They have not had in Belize a strong tradition of professional fire service, right? We here in the United States, we've got 200 years of history that's gone into building our fire services that exist today. They've been a country since 1981. So they just don't have that same run of experience. They don't have that same depth of experience. And so we're working very closely with them, not only to develop their rescue capabilities, but also their indwelling fire service capabilities. And that looks like officer development, dispatch development, basic firefighter training, the things that we take for granted here that they've just never had access to. Specific to this, the dispatch system. So this is one of the things I'm most proud of, right? There it is again. But I think to understand what we've done there, you have to understand where Belize is coming from. So before the Beacon emergency dispatch system that we implemented, there was no centralized dispatch for Belize. When you wanted to call the fire department, you had to know the 7-digit number for the closest fire station. And when you called that number, it would just ring to the front office. And if the firefighter was there on duty, they'd pick up the phone. Where's your fire? Okay, we're on our way. They'd hang up the phone, jump in the fire truck, and come to you. That's it. There was no connection back to a dispatch center, right? There was no connection between that fire station and another fire station. There was no way for them to ask for help. And there was no way for them to keep you on the line as they were responding to that fire to find out if things were changing, right? So if you're trapped in the back bedroom, you couldn't communicate that to the firefighters responding. And worse yet, if those firefighters were already out on a call, there was nobody to answer the phone. So your house could be on fire. You could be trapped in a back bedroom calling the local fire station and nobody knew you were there. And you may not get any help from that if they were already out on a call. And then, as I mentioned, from the firefighter safety perspective, if they were on their way to the call and it sounded like a big one, they had no standardized way of calling for help. They literally came down to the fire officer using his personal cell phone to either call the next fire station over or to call all of the local firefighters to come in off duty. And that was one call at a time. Hey, Joe, can you come in? Hey, Frank, can you come in? Hey, but never mind, I'm on scene, right? And maybe you only got too deep on your phone tree. So it was a really, really poor system. It was an ineffective system and it was an inefficient system. There were a lot of barriers that we ran into, right? So we identified we needed to improve the dispatch system. Let me rephrase that. They identified they needed to improve the dispatch system. They approached us to assist them in developing and implementing a new dispatch system. There were a lot of barriers to that implementation, though. Things like lack of infrastructure, right? We in the United States, again, taking things for granted, we have a radio network that covers almost the entire country, series of radio antennas, where theoretically, I could pick up a walkie-talkie here in Seattle and talk to somebody in New York, right? If you linked all the towers through appropriately, it would take you a while, but you could do it. They didn't have any of that infrastructure. They didn't have any landline telephone infrastructure, right? Because as a developing nation, by the time cell phones came along, they had never put in the landlines. So they had gone from nothing to cell phones in one step, right? There was a lack of trained dispatchers because it just didn't exist. There was expensive implementation because to build a system like we have here in the United States would cost tens of millions of dollars. You know, as a for instance, if we were to take the Kitsap County dispatch system and replicate it there, I believe the number is between $40 and $60 million, right? To build all the towers and the dispatch centers and all the equipment and hardware that we've built here over the last 50 years, right? It's not like we just showed up one day and wrote a check for $60 million. We've been building our system since the 1960s, right? They didn't have that. So if we were to try and replicate what we do here there, it would have been impossible. There just was no budget for it. And then we ran into cultural resistance, right? Firefighters all over the world are the same. 150 years of tradition, unimpeded by progress, right? We never let good ideas get in the way of how we've always done it. So we had some cultural resistance from those guys. And then we had some cultural resistance as well, just from other members of the public. Who are these white fellows coming in and telling us how to do business, right? Who are these foreigners who are going to try and tell us how to read the system? So we had a lot of barriers we had to overcome. And we did that using a really unique piece of software called Beacon. And what Beacon does is it turns my cell phone into not only a VHF radio, but also what we call a mobile data terminal with maps on it. It turns it into a two-way communication device, and it turns it into a dispatch terminal. So I can literally log in from here right now on my phone or from my laptop, and I can dispatch an emergency call in Belize. And that's because it's all Web 2.0 based, and it's all based on the infrastructure of the web and of cellular networks. So it meant that we could implement this system without all of those infrastructure costs at literally pennies on the dollar with existing technology. The good news about Belize is because they went from nothing to a cell system, they have a very extensive cellular network. It's very difficult to not have service anywhere in Belize. It's been really strange. You'll be in a cave somewhere in the jungle and you step out and you got LTE. It's amazing, right? I can't even go on Bainbridge Island and make a cell phone call, but somehow anywhere in Belize, I can on the internet practically. So because that infrastructure already existed, we were able to take this system at a cost of about $12 per responder per year of implementation and create a comprehensive emergency dispatch system. In addition to that, once that was in place, we were able to build an emergency communication center. And this exists in a new fire station that was built in the Capitol. It's a fully equipped 24/7 emergency dispatch system now. And what's exciting is because of that Beacon technology, the cost of implementing that system, again, was pennies on the dollar compared to the US. Everything works on off-the-shelf technology. So you can take a laptop, you can take a Dell computer off Amazon, and you can set it up as a dispatch terminal. It doesn't require any specialty equipment, which is unique to this system. And then we were able to bring in outside assistance from local telecom companies to create a brand new emergency number, which is 990. So now in Belize, if you're within the response area, and it's a growing system, so it's not nationwide yet, you can dial 990 and you'll get a professionally trained emergency dispatcher who can connect you to any fire station in their region and who can dispatch multiple firefighters out of those regions or out of that region and out of those stations. In addition to that, remember I said that the second half of the problem was that the firefighters didn't have a way to communicate with each other and they didn't have a way to communicate with the telecom center. Because Beacon is web-based, we were able to implement a new system using tablets mounted in their apparatus in their fire engines and ambulances so that they can now do two-way communications over that same cellular network. So now not only are they being dispatched to the call, but they can also report back to dispatch what they're finding when they get there and ask for additional resources. And so when they pull up on a fire and they say, this is a big one, all they have to do now is hit a button. And the dispatch center sees that come across their screen. And the dispatch center has protocols that says, okay, I need to request 3 more engines and I need to do a callback of all off-duty personnel. And now instead of a phone tree, right, that dispatcher hits another button and every firefighter's phone in the entire country goes off and says, or the region or the district or whatever it is that dispatcher determines they need. So they can bring every firefighter in off duty to either respond to that fire or to backfill their fire stations so that you don't run into that same situation where you call and nobody's available to show up. So essentially we were able to, I think total cost of implementation of this program was less than $50,000. And we were able to implement a centralized dispatch system that, while different than an American system, is as effective and as efficient as an American system. Since that time in the first year, in this first year of implementation, we've dispatched 1,100 calls total. So that's going from no dispatch system to 1,100 calls in 12 months. And it's tough to understand when you don't have a frame of reference. But again, getting firefighters to do anything new is really tough. So to get them to go from nothing to 1,200, that's a big accomplishment. Of those, 64% were fire, 14% were medical, 15% were rescue, and 7% were trauma. Trauma meaning car wrecks, falls, that sort of thing, as opposed to a medic being a heart attack, an illness type issue. So what does all that mean, right? What does dispatch mean to us? It means consistent access to help. When you pick up that phone and you call 990, there's going to be somebody on the other end. Even if the firefighters are out, there's going to be a professional dispatcher there to answer your call and take your call and deploy the appropriate resources. It means faster response times, right? The faster your call gets through, the faster the firefighters can get out the door and on the road to you. It means access to additional resources when they're needed. It means improved firefighter safety, which is near and dear to my heart. It means better allocation of existing resources, right? Making sure that the right equipment's going to the right call. Because again, before, if you called and your closest station had a fire engine and you needed a ladder truck, sorry, you're not going to get it, right? Now that we have centralized dispatch, now the dispatcher can make that decision and say, this is a high-rise building. We're not going to send just a fire engine. We're going to send a fire engine and a ladder truck. And there's people trapped. We're going to send an ambulance as well. So you're not getting just that one resource. You're getting all the resources you need. Better community understanding of available resources. And then it's turned into a catalyst for improved service and community outreach. Because the Belize National Fire Service traditionally struggled with development, they didn't have the best reputation with the people of Belize, right? They were seen as, you're just here for fires, you play checkers all day, you really don't do anything, right? Now, because they're seeing them respond to those calls and they're having people answer the phone when they call for help, significantly improving the standing of the fire service culturally with the people of Belize. It's been a significant improvement. I got a great video.
Safety is a cornerstone of peace of mind. And for a long time, the Belize National Fire Service has been doing our best to help ensure the safety of the Belizean public. We see that there is more we can do. This is why we have embarked on certifying firefighters to also be able to provide emergency medical services to the communities that we have been proudly serving. This means that we can now assist with both fire and medical emergencies with efficient time. We went even further and created the 990 Communication Center, an emergency dispatcher service developed for quick responses to fires, accidents, and health calls. This service is already presently available for the Cairo region. Just dial 990 and the first question you will be asked is, 990, what is the address of your emergency? You see, if we don't know where you are, we can't get you the help you need. Stay on the line and continue to answer the questions of the dispatcher. They will use the Beacon app that was developed by Trek Medics to give real-time updates to emergency responders as they approach the situation and will be prepared to serve you. The Belize National Fire Service, U.S. Embassy, Belize Heroes, and Empact Northwest have partnered to make this emergency medical service available. We ask for the public to partner with us and call 990 for emergencies. You are help until help arrives.
So where are we going from here? So we've talked about what we've done. We've talked about the problems we've solved. What's unique about our organization, I think more than others, is this. It's how we run our organization, right? Because we do all of these things, but we do it differently than just about any other NGO. First of all, we function in what's called a social entrepreneurship model. We don't live in that old space of nonprofits where we send you a mailing every month and ask you to donate dollars, right? Please give us $1. Here's a picture of a sad child. Give me some money, right? We don't do that. That's not an effective way to run an organization. Instead, we pursue business opportunities, even as a nonprofit, that generate revenue to support our missions. And that looks like our rescue training program, right? That looks like people who pay us for rescue training, then us taking that money and rather than being a for-profit and putting it in our pocket, which is fine, we use that to run the rest of our missions, right? Rather than focusing on single individual donors, $20 a piece, we build relationships with private sector partners who support our work, whether that's Cisco supporting our dispatch system or a large scale rescue manufacturer, rescue equipment manufacturer supporting our rescue training operations. In addition, we maintain a stakeholder mentality. We believe that everybody who comes to the table to accomplish our mission is of equal value. That's our donors, that's our recipients, that's our volunteers, that's our staff. Everybody brings something important to the table, right? Whether you are a $5 donor or a $50,000 donor, you have a right to have, you have a stake in what we do, and you have a right to be heard. And we believe in hearing all of our donors and all of our recipients. And we believe under that stakeholder model in keeping our service recipients #1 in our book. The most important person we serve is the person on the other end of our services, right? It's that person trapped in a building. It's that firefighter in Belize who needs rescue training. That's who's #1 in our book under our stakeholder mentality. And then staff and growth and volunteer growth. We work very, very hard to support our staff. It can be challenging, but it's important to us that we always pay a living wage to our staff. So we make sure that our staff understand how much we appreciate them. We throw a lot of effort and energy into training our volunteers and making sure that they're well equipped, because we want to respect the contribution they're making to our mission. gonna skip that one. I'm gonna skip that one. Oops, wrong way. And then strategic partnerships. This is key to us. These are all organizations that we partner with. Again, we don't believe in competition in the nonprofit or NGO sector. There's nobody we won't work with at least once. There are people we won't work with twice, but there's not many. There's nobody on this list we won't work with twice. So we believe very strongly in partnerships and the power of partnerships. And you'll see that these are made up of all different kinds of groups. There's nonprofits up there. There's for-profit companies. There's government entities. And they're all key to our success. They're all stakeholders in our mission. Ma'am.
But you do have administrative costs.
Of course, we do.
I understand all of this goes toward your projects,
Mhm.
your work, so you've still got administrative costs.
Yep, and we cover that again through those social entrepreneurship ventures. So for instance, our rescue training. And so because we cover our administrative costs with our fee for service work, that means that every donated dollar goes directly to the mission. Does that make sense? So we have business activities, right? So when we put on a rescue class, right? If you're a local firefighter and you want to come take a rescue class, you pay for that course. Yep, and that fee is what pays for our administrative overhead so that the donated dollars go directly to the mission. So when you make a $20 donation, that $20 doesn't go to my paycheck. My paycheck comes from our rescue training and our other business ventures, because I want to make sure that the money you donate out of your pocket goes to where you want it to be. It shouldn't go to me and fueling my coffee habit. It should go to the service that you're trying to support. And that's one of the reasons we adopted that social entrepreneurship venture model, was so that we could ensure that those donated dollars went right to where they were intended to go and didn't feed my coffee habit, as much as I love coffee. So we face challenges like every other organization, right? We're a small organization at the end of the day. It seems like we have a lot of reach, but we're a very small group of people trying to accomplish a big mission. And we obviously have challenges like anybody else, right? We have challenges in volunteer recruitment and retention. This is a really challenging space to retain volunteers in. It's easy to get them. It's hard to keep them because it's a high commitment, low reward venture, right? It's hard to find people who are willing to fly to Turkey and sleep in a tent in 20-degree weather in the middle of a disaster space, right? I've slept through monsoon rains on the roof of hotels in the Philippines. It's hard to get people who are excited about doing that, right? And so we struggle every year with volunteer retention. We struggle with donor recruitment and retention. It's very hard to sell a mission that could happen, right? It's easy to fundraise on the back of a disaster. It's hard to fundraise the other 9 months of the year, right? When Turkey happens, we're flooded with donations. The rest of the year, it's very, very challenging. That's something we really struggle with. Variable funding is very challenging, right? We do great 3 times a year. So when we do our rescue courses and when we do our gala, we're flush with cash. The rest of the year, unless there's a disaster, it's very difficult for us to maintain that funding, which means it's difficult to predict our funding. And that creates a lot of challenges where I oftentimes have to tell people I can't spend any money, even though we have it, because we have to make it another 3 months before the next tranche of funds comes in. And then staff recruitment and retention. The nonprofit sector is so difficult. There's so much competition for our talented people, and we get them, they're talented, they're excited, they're successful. And then they say, well, but I can make twice as much in the private sector. And I have to say, you're right. Like, I'm going to pay as much as I can to retain good talent, but it's very difficult to compete when Amazon and Microsoft are in my backyard, right? And I'm bringing people in with master's degrees. I'm bringing in highly qualified, highly educated people. They've got families to feed too. So we struggle with that staff recruitment and retention. We're trying our best to maintain parity with the private sector, but as a nonprofit, it's very challenging. So those are the challenges we face as we grow. I'm not here to pitch you for donations, but if you wanted to, I would be a fool to not at least put it up. And I'll have my business cards if anybody wants to make a donation. That's the end of my planned speech. Like I said, I talk fast and I talk too much. So please let me know what questions you have. I just made it, didn't I?
You did wonderfully. And I'll say also that video that you had, we can post it on the web anyway.
Oh, that would be great.
So I think we can do that. There are several questions, and I know there's questions from the audience here, but what is your total amounts that you're dealing with? What's your total budget?
Our total budget for this year will be just shy of $300,000.
$300,000.
$300,000, yeah. So we do all of this with an operating budget of just under $300,000 a year.
And
Staff.
that includes
yes.
staff. That's very-
Yeah.
And I wondered who thought of the beacon system, because that sounds for $50,000
Yes.
to be, like, what of your talent, what of the people in your group, who thought of that?
That actually came from one of our partners. So we have a partner called Trek Medics International, and they're the software developer. They're a nonprofit as well, but they're a nonprofit software development company. And so, which is really unusual. You don't see that very often at all. And so we've partnered with them as their primary implementation partner. They do the technology side, we do the training and implementation side. And we actually started with them right at the same time in response to Haiti. So their co-founder, or their founder, and now was a paramedic in New York City who deployed to Haiti, and that's where we ran into him initially. And we've just followed each other as organizations as we've grown. And this was a perfect marriage, because we're doing the emergency systems development, they're doing the software development, and it was a match made in heaven.
It really sounds like, did you now think of partnering with Trek? Was that your decision? Because it seems like it's a very talented group that has started here in the Northwest. And we saw all the partners that they have. These are very big partners. How did you accomplish starting from almost nothing to being as big as you are?
I have made so many phone calls in the last 10 years. It's unbelievable. I think it's our humility, and I think it's capitalizing on opportunities. So every time we get the opportunity to work with a group, we will, and we work very hard to maintain and deepen those relationships. And I think because we do bring a lot of humility to the table as an organization, I think we're easy to work with. And people see us for who we are, being those who just want to do good work. And so because we don't believe in competition, it's fairly easy for us to recruit partners. It frankly has never been a challenge. The challenging ones are the really big organizations, because we're not big enough to get all the headlines, right? So when you see Ford up there, that was a lot of work, right? To get the Ford Motor Company on board with us, that took some work, because when they're looking at who they want to sponsor, they're frankly, as business people, they're looking at where their dollars are going to go the furthest, right? What's going to get them the most exposure? Those are my challenging relationships to manage, or those big companies. Little companies are great. Other nonprofits are great.
Probably, does anybody here? I have one more question. You two, but
I've got my mic here. I have a question just about like the practical experience of like navigating language barriers and cultural barriers. What does that look like for you all?
So believe it or not, of those two, the language barrier is the easier of the two to navigate. And that's because English, frankly, is the universal language, right? Coming from an English speaking language, we have a leg up for a lot of the world, because almost anywhere you go, you'll find somebody who speaks at least a little bit of English. A lot of folks in our team have some second language experience or exposure. We've got several Spanish speakers. So working in the Caribbean is pretty easy. We've got a few French speakers. We've got a couple Russian speakers, which has been very valuable working in Ukraine. So the cultural, though, is the bigger issue, right? And especially in the rescue space, because people are vulnerable, people are exposed, and there's a lot of cultural nuance that you might not think of when working in certain parts of the world. And the Middle East is a great example, right? There is a cultural bias against dogs, for instance, in a lot of parts of the Middle East. So when we show up with our search canines, it's not unusual to find families that don't want us using our dogs to look for their people, right? And that's hard for us to understand. But I think we navigate that by always being, number one, sensitive to the fact that there are cultural differences, and then being respectful and deferential to those cultural differences. We'll explain to you, for instance, in the instance of a dog, we'll explain to you why it's important to put a dog on the pile. We'll explain to you the benefit to your family. And if with that information you choose not to take us up on that, we'll never push the issue. We always respect local culture, even if it doesn't make sense to us, but it can be challenging. The other challenge that we run into a lot is a lot of the places that we go have a very macho culture. And so we are the women on our team, and we're about, I think right now we're about 40% women, female for our team. We've ranged between 50 and 60% female for most of our history, believe it or not, which surprises a lot of people. But for most of our history, we've been predominantly a female organization. Yeah, it's great. It's fantastic. Like I said, my wife is on our team. It's amazing. But a lot of those more macho cultures, or cultures that may have a built-in bias against women, those can be very, very challenging for us to work. And it's a tough line to walk, because we never want any of our members to feel, somebody help me out here. What's the word? Demeaned. Yeah, that's great. We never want our members to feel demeaned, but we also want to respect local cultural norms and understand that in a week when we're gone, everything's going to go back to the way it was. And so that can be a very challenging line to walk. Frankly, our female members tend to be more adept at it than our male members. We tend to get very defensive and protective, and it's often our female members who have to tell us to just slow our roll a little bit, and that they're just fine and they don't need our help.
One thing I think that happens when you're overseas is that so many countries have had a bad experience with America.
Mhm.
And so, you know, you're struggling against some history there where we have either colonized or where we go in there and we say, we're the only ones that know what to do. And we demand a reaction from the populace.
Absolutely. And so we navigate that in two ways. When it comes to response, you'll see our uniforms never have American flags on them. And it's not because we're not proud to be American, but it's because we're not there representing America, right? We're there representing humanity. We're there to serve people regardless of national origin, regardless of citizenship. So you'll never see us wear American flags on our shirts. The other one that we do is we always make sure that our development programs are designed without us involved, right? We have to be the removable piece in all of those. So we tell everybody from day one, 5 years from now, we're not going to be here anymore. We don't want to be here in 5 years. In Belize, we love you guys. We'll come back and drink beer, but that is the extent of our involvement when we're done with this project. Everything we do is designed to be handed off to locals and to be managed by locals. So again, even in Belize, we have our first hire for our Belize program was a local Belizean to run the program on the ground. We don't put Americans on the ground running these things. We hire local people to run their own programs, because we have to do that for sustainability. Ma'am.
So you're a locally based organization
Mhm.
with a international impact. Have you thought of replicating what you do here in other parts of the states to, approach other parts of the world?
We have, and we've given it half of a college try before. Did you get the question? Okay. Do you want me to repeat it?
I think.
Yeah. Okay. We've tried to replicate it. We made it half a college try, like I said. It's a very challenging model to replicate because it's so personality based. We've been very fortunate to bring the people in that we've had, and it's really unique. It's a unique group of personalities that make this successful. And we have yet to find a group that replicates it well. Certainly open to the idea. I'd love to find another group of people like us in Louisiana or the East Coast or somewhere else. That would be fantastic, but just have me.
One more question
Yes.
here, two. One, you were about a 3 and a 4 for FEMA, something like that. So what would Red Cross, so we understand this, the rating, what would Red Cross be, for example? What number?
It's apples and oranges. So that's specific to urban search and rescue. The largest team would be like a FEMA task force. So when you see a large scale event happen in the United States and you see the airplane land with all the guys in blue suits get off, that's a FEMA task force. And a type 1 task force, which is what Washington State has based out of Seattle, would have 150 people on it, fully capable of managing any scale of disaster, with their own physicians, their own dogs, their own engineers, all of their own containerized equipment. They go to McCord, they load everything onto an Air Force plane, and 150 people show up. When we show up, you get 10 of us. So it's really apples and oranges. The key differences, though, are the degree of depth of victim. So our team is set up to manage people in what we call lightweight construction. So that's wood frame buildings, that's unreinforced masonry, brick and masonry block. What they focus on is the heavy concrete construction. So our rescues happen in the first 24 to 72 hours. Their rescues happen to be the ones that you hear about 4, 5, 6 days on, where they've burrowed through 40 feet of concrete to get to somebody. We can find them, but we don't have the tools and equipment to get to them. So our role is to get those lightly trapped people, the people trapped in buildings like this, and then to find and mark the people who are deeper, so that when those big teams get there, then they can go right to work getting to those folks.
Question was also, just what was the rating scale? Does it go up to 100?
Oh, it's-
You're 2 out of 100 or 2 out of 4?
1 to 4.
Oh,
1 to 4. Yep.
perfect.
So 1 would be the biggest, 4 would be the smallest. And then there are unrated teams that would be smaller than that. For an
The
organization,
question was, how can we donate our miles to this organization?
I'm going to send you to another organization. So we work with a partner called Airlink. And Airlink is a nonprofit entity that is designed for just that. So they work both with individuals who donate miles, but they also work with airlines. So when you hear of Alaska Airlines donating 1 million miles after a disaster, oftentimes what they've done is they've donated those miles to Airlink, and Airlink becomes almost a nonprofit travel manager. Well, we call them up and we say, I've got 8 people I need to get to Turkey. And they talk to the airlines, they find the airlines that have donated miles, they have their own bank of miles that they can use, and they for our travel, they pay for our equipment. So it's unusual to hear in a nonprofit sector, but I'm going to send you to somebody else to donate those miles. And they're an amazing resource.
And I'm trying to get it to be.
There. The one last question about corruption. Is it are you perhaps less corruptible or able to deal with local corruption better than some of the other bigger groups because you deal so directly with people and you can get the resources right exactly to them, whereas the others do higher levels, which are more corruptible?
Oftentimes, yes. And I would say we still have to manage corruption, right? A lot of parts of the world, corruption is just how things happen. The question was, how do we manage risk to our members when deployed or our staff? We don't circumvent large government agencies, but we're frankly too small for the large, and we're fairly selective about who we deploy with. So we can get around a lot of that large scale. Our members and our staff. That isn't to say we don't pay for rides. We go a lot of places. It isn't to say that we don't than a lot of other organizations. So the experience you have with the American Red Cross would be entirely different than the experience you would have with. We have to deal with, especially because we're willing to do things like conflict medicine where we are. So we put people right on the front lines, hire local players. We don't put a rifle in their hands. We don't put them in a trench. Choose our drivers from a very specific group. And that's just part of being a member of our organization. We can navigate around a lot of that. We're well insured, right? Everybody has evacuation insurance. Everybody has medical insurance for $20 that covers them if they're injured in country. But to be clear though, I want to be clear, we never, if I had to put a number, 1 to 10, ever get engaged. 10 is being in the trenches with a rifle. We have been directed to the appropriate people to hire, so we don't pay to bribe anybody, and that's not how we don't do things negligently. We always make informed decisions, but we do make informed decisions to put ourselves in risky positions. That's probably the best way to frame it.
Thank you very much, Jake.
Thank you. And I do apologize for talking so fast. I put way too much into the slides and then I try to get through all of them as quickly as I can. So I'm like a kid at a birthday party, right?
It was wonderful. It was wonderful. Thank you again.
And my information is there. I welcome any calls, emails. I'll leave my business cards as well.
To the people, have a good night. Thank you for coming to Enlighten.